So welcome everyone to our third webinar in the series with respect to the Health Professions and Occupations Act. My name is Diane Millette. I'm the registrar of the college, and I'm very pleased that you've chosen to join us late in your day for this webinar. I'd like to acknowledge that today I'm actually calling in from the ancestral lands of the Okanagan Seals people, where I'm privileged to work here from time to time. So our focus today is going to be on delegation, and Joanie Bouchard, who is our interim chief regulatory officer, but also the HPOA lead for the college, is going to lead the discussion. Joanie has been very involved in developing the bylaws, reviewing all the feedback, preparing the consolidated set of bylaws. So she's in a very good position to actually share information about the delegation bylaws with you today. Joanie has also had a number of conversations with ministry folks about delegation as well. We have an hour scheduled for this webinar. I'm not sure if we will need all of that time, so we might be able to give you a few minutes back in your day. However, we will see how it goes and how many questions that folks have at the end of this. So with that, again, welcome. Thanks for joining us, and I will turn it over to Joanie.
Thank you, Diane. And I will echo the thank you for taking some of your time in your day to be with us today. Okay, let me see if this is working to advance. It is not. So if we could advance to the next slide, Naomi, please. At least okay, we were trying a new thing with technology today, so bear with us. So as Diane said, today, we have scheduled a webinar for an hour, just in case there's lots of questions. But the agenda for today will be to review the terminology that is related to delegation, talk a little bit about what's the framework under the new act, our bylaw at the College of Health and Care Professional of BC, a few examples, and then we'll take questions. We do think we'll have lots of time for questions, and if there are none, then that means we give some time back to everyone. So next slide, please. So what is changing and what is not changing with regards to delegation? We'll talk about terminology in a little while, but terminology and definition are changing a little bit, and mostly it is because terminology, the concept of delegation and the word delegation has been used quite differently amongst the profession this college regulates, but also the other profession with whom you probably practice with. And so with the HPOA coming in, there are definitions that are changing a little bit, and we'll review that just so that we have a shared understanding of what those words mean. What's changing is also what the college is required to put in bylaw with the act coming into effect versus what maybe was before in standards for some profession and even in policies. What's changing is also a little bit the college approach to delegation. And what I mean here is that some profession may notice that colleges will approach delegation slightly differently as of April 1st. So this will be potentially a change if you have been used to hear about delegation a certain way, but it's definitely not changing how people practice on a daily basis. And I'll explain a bit more when we start talking about example, but as we transition under this new act, that's really an important message that we want to provide to people, is that the intent of delegation is not to come and change how people are practicing today, how they're actually working with other people, and also your accountability to when you are asking other people to perform specific activity with regards to your scope of practice. What is not changing is also your responsibility in assessing suitability to assign or delegate and provide direction, which is something that you already do, whether we use the wording of delegating or assigning, which I'll explain shortly. you are responsible to determine like, is that person that I'm asking to do this competent to do it, and what kind of direction should I provide? That's not changing with HPOA. That's the same. And also making sure you apply a patient-specific lens when you delegate. So changes to terminology, but not probably so much changes as to how you practice today. And we'll continue talking about it. Next slide, please. So under HPOA, the term delegation is used to define a legislative action of directing the performance of an aspect of practice or a restricted activity to a person that's currently not authorized to practice the designated health profession. So that means if you are a speech language pathologist and you are using delegation to direct the performance of an aspect of practice of restricted activity to someone who is not an SLP. Restricted activity is defined as what is being prescribed by the minister. With the transition to the HPOA, the list of restricted activity can be found in the Regulated Health Practitioner Regulation. So we now have a central list of the restricted activity versus in the current framework of the Health Profession Act, where you had to go to the profession-specific regulation to find the restricted activity. This is now being centralized in one regulation, and then each profession is being granted those specific restricted activity in our college regulation. The term aspect of practice is defined in the HPOA as an activity that requires professional knowledge, skills, ability, and judgment. And I think this is something that has been bringing a lot of confusion, because when it is read like that, it may look that this is pretty much everything you do as a health professional, because I'm sure most of us will agree that what you do as a health professional requires knowledge, skills, ability, and judgment. We are trying to bring a bit more clarification as to what the college consider as an aspect of practice is really a significant portion of your scope of practice. So really, we describe this as a circle within the circle of your scope of practice that includes several clinical activities as opposed to one individual clinical activity. And some example we can provide to you is an assessment, interpretation, establishing a treatment plan, or concluding on a patient assessment and making some findings. So those would be example of what we consider to be an aspect of practice. Next slide, please. If we move on to talk about an assignment, so the differences between the legislative action of delegating versus assigning, the assignment is a process to request to a non-regulated person to complete activities and procedure. It's usually part of the role and function of an assistive personnel, and it's something that's routinely done. So we do expect that person to be doing this as part of their job. It's not because it's not a delegation that we consider that it doesn't require direction or instruction. It actually does. Most of the time when a health professional assign an activity to a non-regulated person, you need to provide direction and instruction, and then you may actually also decide it requires supervision based on the patient context. We often, the term task will be used as opposed to like an aspect of practice or an activity, but we could also use the term activity, but we have seen the term task being often used. So in this context, the college would see a task as a single clinical activity that is part of an aspect of practice, again, part of that big circle that is the assessment or establishing the treatment plan. And it is not a restricted activity. A task may be complex and requiring judgment, but it is usually a lower risk or probability of a risk. So some example we could provide is completing a screening test that's part of the assessment that the professional is doing, or completing an exercise that is part of the treatment plan. So assisting a patient to complete an exercise, that's part of the big chunk of what the treatment plan that has been established by the health professional. Next slide, please. Thank you. So delegation under HPOA, so the act requires that unless the college puts in bylaw an authorization for a licensee to perform delegation, that they're not authorized. That means that you need to see that authorization in bylaw in order to know that you can perform delegation. And the act also asks the college to put in bylaw some what are the prohibition, requirements, and limits. And specifically, that is the circumstances and the type of setting in which delegation may be performed, the education, training, and experience that the person must have in order to perform a specific delegation, and then also the level of supervision of direction that we consider that is needed. Next slide, please. So what you will find in the college bylaw, and of course the college bylaw are still posted for consultation. It's going to end tomorrow. There might be some small modification as the board look to approve them, but most of the content is currently drafted. And what you will see in these bylaws is that the college took as a starting point what we refer to as a lift and shift approach, meaning that we look at the profession that were currently already authorized to perform delegation under the framework that is the Health Profession Act, and we ported that over to draft under the new bylaw. And we will look at including and adding other profession as we are able to perform the analysis that is needed to be doing that addition. We then apply the new terminology that the new act is bringing, and also adjusting to consider if what was currently in the framework was a delegation or an assignment. Because as we look at what we add from the legacy documents prior to amalgamation and some of the current standards, the terminology was used quite differently, and sometimes it was more an assignment than a delegation. And so we made some of these adjustments. You will also see that the college took the position that there should be no delegation of aspect of practice for any profession. And again, what we mean by that is that we don't think that it's appropriate for a health professional regulated by this college to delegate these big chunk of your scope of practice, to delegate fully an assessment to someone, or to delegate fully to establish a treatment plan. You may very well ask like someone in your care team to help you to complete some of these tasks, to complete that aspect of practice. But at this time, that's what the college position is, and that we think is in the best interest of the public. Delegation to student is enabled, and that is for any restricted activity that your profession is authorized to perform, or any aspect of practice. So in that case, if you are supervising a student, it is appropriate to have them perform aspect of practice as part of their learning and go through the process of delegating that, setting the supervision that is required in the instruction. Next slide, please. Just going through this so that, again, for those of you who have not seen the bylaw, that you understand what's included. So some of the general requirement that we expect if you are using the legal framework of delegation is that you need to ensure there's appropriate instruction that are being provided in terms of how the delegation should be performed. It needs, of course, to follow the standard of practice for the college. Consent needs to be obtained and documented. The delegation in itself needs to live in your record keeping. And that also includes who you have delegated that specific restricted activity that you are asking the person to perform. And the last piece is around professional liability, making sure that it's in place. Of course, that is to cover making sure that to cover the person performing it, but mostly to cover patients. Delegation can and should be revoked if it cannot deliver safely. So that's the responsibility of the health professional. If you realize through that process that delegation can no longer be performed safely, it should be stopped and revoked. And delegation cannot be re-delegated. That means if you've asked someone to perform something, that person cannot ask someone else and delegate it to them. Next slide, please. Other what we call condition for delegation. So as you go through that process, again, you need to ensure that appropriate education and training to perform the delegated activity. If the college would have specific expectation for a restricted activity, we would put it in bylaw. But usually this is something that we expect the health professional to determine if the person that you are asking to perform the delegation has the appropriate training, and that is usually based on the specific condition of that patient that you are asking the person to do it for. You need to consider firsthand knowledge of the affected patient in order to determine suitability. And unless it's specified in the delegated activity and bylaw, it must take place in what we refer to the healthcare facility. And this is actually a term that's defined in the Act. And the Act defines a healthcare facility as a hospital, a clinic, an institution, or other type of facility through which a health services are provided. So this is typically the workplace where, like the work environment where you work. There are some exceptions that are being provided, for example, for audiology and hearing instrument practitioner as they work in school and other work setting where delegation may be appropriate. And we've actually made those exceptions in bylaw. Okay, so a few examples that I'm hoping might help clarified all of what I've said before. So wanted to point out some clear example of delegation of a restricted activity or aspect of practice versus what we would consider an assignment of task. So some of the restricted activity that appear in the regulation that will come into force on April 1st is inserting a device into the ear canal. And so this is something that is being allowed for delegation in the bylaw in the context of a hearing screening test. Administering topical drug is also a restricted activity, and that is something that is being allowed to delegate for optometry. And making hear mold impression is also a restricted activity, as there is also the restricted activity of inserting a substance and also inserting fingers and other device into the ear canal. So those are included in the bylaw if you look at them currently. In terms of example of assignment of task, and I built this table based on already feedback, question, and discussion we've had with the health authorities. If you still are wondering if some of what you do in your practice would be considered an assignment of task or a delegation, please feel very free to use our Q&A, and I will do my best to address it at the end. So mobilizing a patient within specific parameters, I'm not sure if I'm pronouncing that right, practicing communication exercise, completing tests that are within an assessment, supervising and assisting during mealtime with specific instruction, practicing again specific exercise, collecting specific data about a patient at your request as a health professional, discussing specific information with patient and family, again at the request of the health professional and with specific instruction, and assisting with record keeping would be example of what we would consider assignment of task. And I'll just use, again, a quick reminder here. Sorry, thank you. That it does not mean because like these things are listed here that it's okay to either delegate it to anybody and to assign it to anybody. As I've said at the beginning, whether you use the legislative action of delegating, or whether you are using the process of assigning a task to someone, it is still the health professional responsibility to determine, is this appropriate for this patient? What instruction do I need to provide to the person? What kind of supervision is needed? And what's the risk involved here? And does that make sense to actually ask someone else to be performing this? Or am I the person who should be doing this in this context? I am ready for next slide. Thank you. So, what to expect on April 1st? As you probably have heard at this point, the college is also working on having harmonized standards for April 1st. So, these harmonized standards will support the delegation bylaw. So, there is the supervision standard that is in there that is useful for registrants to understand how that works together and what is expected from them. And we will also have a standard on restricted activity and certified practice that will kind of complete and provide some useful information for your practice. A lot of information that were potentially existing in standards before for some profession, we will try to move what are not actually standard piece of information into guidelines to continue support your practice and help you make those decisions. And we will continue to update and publish that post April 1st. So it is possible that you will not find it on the website on April 1st. If you don't find it, we really encourage people to reach out to practice support. It may be because we're still updating it. We'll be able to provide you with the information. Or it may be that it no longer will exist and we've replaced it with something else that we can point you to. And of course, as I've mentioned at the very beginning, we will review and add delegation as appropriate for other profession. We know that some profession have already made the point that it could be relevant for them to be authorized to delegate, and we definitely intend to conduct that policy review and analysis and make those bylaw amendments as needed. So just quickly before we go on to question, just a reminder that we have more webinar coming on. So we have one in 2 weeks exactly, which will be on quality assurance and continuing professional development. We actually have 90 minutes dedicated for this webinar because we know it is of interest to people and people have questions. And we have scheduled the next one also in February that will be on discrimination because it is also something that is more clearly articulated as a responsibility of regulator and licensee in the Health Profession and Occupation Act. And in March, we will also have 2 additional ones, which will be on complaints, discipline, and support program, and also one on the practice standard. So we're hoping to also help present and answer question on our new harmonized standards. So I am where I thought I would be in terms of time. So as I said, we do have lots of time for question. And I think, Michelle, that will be you reading the question.
Joanne, before Michelle goes to the questions, I'm wondering
Yes.
if you might just touch on the issue of consent and also recording in the patient record, which those aspects are part of the general requirements for delegation, but people might be interested to know if they do need to document if they are delegating and to whom, etc.
Yeah, so I think the big clarification I would provide there, again, if we're speaking about delegation with the legislative framework that is indicated in bylaws, so for those professions who are authorized and are actually delegating a restricted activity, um, we would expect that there is consent as you would normally do for your health services. And so that consent has been clarified that this, restricted activity will be performed by someone else than you. And the HPOA requires us to also make sure that the licensee documents who is performing this activity. That would be slightly different for assignment, where we would expect you to follow the regular requirement for record keeping, which include a general consent. And of course, that is patient specific too. So if there's specific information with regards to you assigning a task to someone else and performing it versus a delegation, then we would expect for you to provide that patient-specific consent information. But the requirement to actually name the delegatee in your record is not applicable to an assignment. It is applicable to the delegation framework. So I'm not sure if that's what you were hoping for me to clarify, Dan, and if you want to add anything else that I know we've been discussing a lot with some of the question that came up.
No, but I think if people are interested in the details, there is a section in the bylaw entitled General Requirements for Delegation, and that's where aspects like consent and record keeping are reflected. So I would encourage
Yes,
people to have a look.
correct. Yeah.
Thank you, Joanie. We did receive one question in advance, and we've also got a number of questions in the Q&A tool. So the first one we received in advance is specific to dietetics, but may apply to other professions. Currently, many dietitians prescribe the PN, but a physician needs to sign the order. Will delegation allow dietitians to order perinatal nutrition?
Parenteral nutrition. Yeah, I was going to clarify that PN is parenteral nutrition for our audience out there. So the short answer to that question is that the college can only authorize delegation for the scope of practice of these professions. So the question refers to essentially having physician authorizing delegation to prescribe parenteral nutrition by dietitian. So that would be more something that the College of Physicians have control over. In this specific question of parenteral nutrition, this involves prescription of drugs. So there are multiple layers to that question that goes above simply actually delegating a restricted activity, because being authorized to prescribe drugs involves, other acts than just the HPOA. So but the short answer is that if you're asking about like you as a health professional being authorized to be delegated something by someone else, it is that college who have the authority to actually authorize that in bylaw. The college can authorize what a dietitian can delegate, not what can be delegated to a dietitian. So that's the answer.
Great, thank you. And I'll move on to the questions in the question and answer tool. We have a request here if you could please discuss in more detail what restricted activities can be performed by students, such as plus or minus permissibility to perform RAs that require certification versus those RAs that do not have certification limits.
Yes. Okay. Thank you. On the certified practice aspect, so again, in order for some profession to perform specific restricted activity, they may have to have a certified practice, so complete a certificate with specific requirement. The delegation authorize a health professional to delegate restricted activity that is already authorized to their profession without a certified practice. So you cannot delegate a certified practice unless that person already has the authority to do that, because it is not authorized to all full licensee. So no, certified practice could not be delegated amongst, registrants. So a full licensee that is certified to a licensee that is non-certified, and same for students.
Thanks, Shoni. There are a number of questions that I'm seeing about supervision of students and assistants and what delegation means. So specifically, what does that mean? And just need some clarification since I'm not familiar with this wording.
What, the assignment, you mean?
It says, it says, talking about supervision of students and assistants, what does that mean in terms of delegation?
Oh, student and assistant. So again, when we refer to you having students, of course, if you are actually asking a student to go and perform either a restricted activity or a whole aspect of practice, so completing a whole assessment, the section of the bylaw apply in terms of you determining what level of supervision is required, and also making sure that the person is competent, which I am 100% sure is already what's happening in practice. When you are having a student and you're asking them to go off and perform like an assessment or, like perform like a treatment plan, you are determining, is this student ready to do this independently? Do they need to have me there, or do they need just to have a check-in before and after? And so this is the same. We are essentially just complying with the act and the new framework and ensuring that we are enabling people to continue doing this. So it is not like it should not change how you're doing it now. But if we are talking about student, this is how it is. Assistant, I'm assuming it refers to if you are working with support personnel in your team and you're assigning them to complete some of the example I provided, for example, today. Again, we would expect you to determine the level of supervision that is needed, and if they are competent and they don't need the supervision for this patient specific, then that's how you would provide instruction on it. Which again, I am sure that is how it's done in practice currently.
Thank you, Joanie. Continuing on with the student questions, there's a question here about what if we supervise a student from another profession, like a psychologist supervising a clinical counselor? Well, they're not regulated yet, so I'm not sure if we can tackle that question. But are there situations where there might be one profession supervising another student of another profession?
Well, we're talking about delegation here. So we're talking about delegating like a portion of your scope of practice. So I'm struggling right now to imagine how, for example, like an occupational therapist would delegate a portion of their scope to a physiotherapy student. Like I can usually the context of delegation and why we enable this to students is for the purpose of training the profession to practice your designated health profession. I understand there may be some overlap of scope of practice, and that exists right now with some profession, but in the context of the student, the purpose here is really for the designated health profession to train a student. If the education program is okay with having different supervisor, like I would have to, yeah, I think I would need a better example in order for us to provide a concrete answer. But definitely the purpose of that section of delegating to student is for the purpose of training your designated profession to that student.
And maybe I can add to that. The recognized education program also has a role in determining what can and cannot happen with
Yeah,
respect to delegation to students. So some of it will be directed by the education program itself.
true. Yeah, thanks, Diane.
Thank you. We have a question about not supervising a student, but an applicant. We do see that with psychology. So how are supervised applicants to the college covered under the drafted bylaws and the HPOA?
Well, that depends what that applicant is doing, I think would be the question. Again, delegation has been there's delegation versus assignment. So I would need to better understand, are we talking about assigning some tasks to an applicant? In that context, I think, again, we're talking generally about making sure that person has the right knowledge, has the right instruction, and that's based on the patient specific. The bylaw are not intended to allow delegation of aspect of practice and restricted activity to applicant because they're not registered yet. So they're not a student, they're not enrolled in a program, and so that would not be covered. But I'm wondering, I'm not having the details as to does that fit under an assignment or does that actually fit under delegation? But that is how the bylaw is structured, that this is allowed for students. And yeah.
Thank you, Joanie. this is a very profession specific question. What would be, or what are examples of aspect of practice for psychologists that would constitute delegation? We might have to go to our practice advisory team.
Yeah, well, the ministry has not provided any example, although they have put the term in the act. So it does leave us with a bit of a difficult position to kind of try for us to really make that determination. Again, when we have discussed it for the college, we are seeing aspect of practice as those big chunk of your scope of practice. We're talking about assessment. We're talking about probably making a diagnosis, which is a restricted activity for psychology. We're talking about, making maybe other conclusion and finding, and also establishing a specific treatment plan and actually providing that, executing the treatment plan is what I would probably see right now as high level. Maybe it's not profession specific enough. But right now, the aspect of practice have not been authorized to delegate for any profession. We have looked at specific restricted activity. And again, as I said, we did a lift and shift of what was currently authorized, and we're going to consider adding more as we complete like a policy review and analysis and probably engage with the profession to better understand what's needed too.
And I think in response to that question, psychology is not authorized to delegate an aspect of practice or a restricted activity, with the exception of delegation to students. And that's along with dietetics, occupational therapy, physical therapy, and opticianry. I believe those are the five, Joanne, that are not authorized under the bylaws as proposed.
As proposed, yeah. And those who are authorized are only being authorized for restricted activity. We have not allowed any aspect of practice to be delegated as of now. We have not been provided with an example where we think it would be in the public interest to be delegating those big chunk of your scope of practice to someone else to do. But again, as we continue to do in a policy analysis and engage with the profession, if there are specific examples that we actually think would be in the interest of the public and could be done safely, then obviously that's the goal of adding those after April 1st.
Great. Thank you both. What constitutes the difference between a task, where a task is specifically being assigned by a healthcare provider to a non-licensee or registrant, versus where the non-licensee is receiving specifically consultation from the healthcare provider?
God, I'm so visual. I kind of got the first part of the question, but I think I got lost in the second part. So could you repeat it again so I can?
Absolutely, yes. So the difference between a task, where a task is specifically being assigned by a healthcare provider to a non-licensee, versus where the non-licensee is receiving specifically consultation from the healthcare provider.
Yeah, I'm not sure I understand what that means. Do you, Diane? Because I'm like, maybe that's why I got lost, because I was like, I'm not sure I understand the question here about receiving the consultation.
Yeah, I'm not clear either. I mean, Joanne, you have your definition of task. Maybe you should just go back to that to clarify. Task is an activity.
Yeah, the task is a single clinical activity. It's not a restricted activity. It can be complex, but it's usually something that is a lower risk and a lower probability of that risk occurring. Like usually, like some of the example I gave in this presentation were like screening tests, for example, specific exercise within a treatment plan, um, assisting and supervising like during somebody completes like a specific exercise. So that would be what we are including. The second portion of the question refers to what's the difference to a non-licensee receiving consultation. Is that the wording, Michelle?
It is. Yeah, versus the non-licensee is receiving specifically consultation from the healthcare provider.
Yeah, I don't know if they're wondering if like a non-licensee can receive a referral and making decision about consultation that are being received and if that can be, but I'm not entirely clear that's what being asked. I think I would encourage that person of maybe reaching out by email and providing a bit more detail. And of course, I'm happy to kind of provide like an answer because otherwise I feel I'm going to be kind of dancing around it and not really providing a clear answer.
Yeah,
So maybe
we will take all the questions afterwards and post them on the website too. So we can see if we can contact the question asker and see if we can clarify what exactly they were asking. So we'll post that on the website.
okay.
Uh, there's a very specific question here. Is making a diagnosis section limited to physicians or does it include psychologists?
So making a diagnosis is a restricted activity that is listed in the regulation that lists all the restricted activity. And then if you look at our college specific regulation, then some profession have been granted the restricted activity of making a diagnosis that relates to their scope of practice. So usually that's the context of you're being granted the restricted activity of making a diagnosis in relation to your scope of practice. Psychology has been granted the restricted activity of making a diagnosis in relation to psychology.
And it specifically says in the regulation, may diagnose a mental disorder or a condition if you are using the title psychologist.
Terrific. Another very detailed question. A client's home in the community is not a healthcare facility, and OT assistants and PT assistants often practice there as per the request of an OT or PT, and they follow an established OT-PT treatment plan following an OT-PT assessment. Can you please clarify if the tasks that they do there are okay to be delegated and permitted?
Yes, because they're not delegated, they're being assigned. Again, in the context of the legislative framework that the HPOA requires us, when we refer to delegation, the expectation that these will occur in a healthcare facility, as I provided the definition, the context I'm hearing here, when an OT assistant or a physio assistant goes to the home to help and contribute with some of the example I've given, they're being assigned a task with specific instruction, I'm sure, and also maybe a level of supervision that will vary, whether it's in direct supervision. And so in that case, yes, that still works with the framework we've shown today and can definitely continue to happen. And we know it's actually very important that it continues to happen.
Thanks, Joanie. And then following up on that, is there any direction on how instructions can be provided for assignment of a task?
Not that we have defined more than what's in the standard right now. I would say that it needs to be patient specific and that it needs to be in a way that the person will understand and is able to carry it out. And so I'm sure that varies. And you may have some employers' policy that apply here in terms of what's expected. But at the college level, I would say that would be what the expectation would be.
Thanks, Joanie. I'm just going through. There's some duplication here. I just want to make sure I'm picking up fresh questions. I was under the impression that completing communication exercises was considered delegation of an aspect of practice, not assignment of task. As this does require a degree of clinical judgment, knowing what cues to use, when to terminate session based on performance. So is completing communication exercises considered delegation of aspect of practice or assignment of task?
Yeah, I know for the speech and hearing profession, the term aspect of practice had been used quite differently up until now. And again, I do want to, I've mentioned at the beginning of the presentation that the way that the HPOA has defined aspect of practice, you would probably have the natural inclination to think that everything requires a delegation of aspect of practice because most of what you do requires skills, knowledge, and judgment. And so are most of the tasks that you assign that I've listed. Like when you are helping someone complete like an exercise, you need like skills and judgment. But the purpose of the delegation framework under the Act is quite it's aiming at like representing a big chunk of your scope of practice, and it is not something that is routinely done and that is expected to be part of the role of someone you work with. So we would, in that case, consider this an assignment. But again, as I've mentioned, it doesn't mean that it's always going to be relevant to assign this task because maybe sometime it's high risk. The patient really needs a lot of cues. You know, the person is not going to be able to provide it. But we would kind of expect that this follow an assignment kind of pathways of determining if it's suitable for the patient, what kind of instruction you need to provide, and the level of supervision. So we have shifted a little bit some of the activities that used to be listed in the standards for speech language pathology as aspects of practice, and we have kind of adjusted that a little bit in terms of what we consider this for the purpose of delegation under the HPOA.
Thanks, Shawni. A specific question for dietetics. Does assignment of mealtime tasks include tube feeding in the home care setting? That is, a dietitian developed tube feeding plan administered by a healthcare worker in the home.
We're talking about administering enteral nutrition. It is a restricted activity, so it would not be an assignment of task. It would be delegation. I know this has been discussed for a few years as something that dietetics would like to see authorized so that they can delegate this task because they can delegate this restricted activity because I know right now it has to go through a nurse, but given that the approach for now was to do a lift and shift because we were working under really tight time frame and we needed to have something in place. It wasn't added at this time, but it is part of the list that we'll look at after April 1st. But it would require a delegation because administering enteral nutrition is a restricted activity.
Thanks, Shawni. I think this question stems from Diane's comment about the role of education programs. You mentioned that recognized education programs have a role for things like direction on how to assign a task. Would that sort of advice not be more appropriate coming from the educational institutions rather than from the regulatory body?
No, the reference to the recognized education programs is in the delegation to students section, and it really speaks to any limits or conditions that are imposed by the recognized education program. So they have a role in determining what they feel it's appropriate for students to be delegated, and would be the most responsible for communicating that. I don't know, Joanne, if you have anything else to add to that.
No.
All right, thank you. Does the healthcare facility section include correctional centers, probation offices, other forensic settings?
Let me look at the definition again. Hospital, clinic, institution, and other type of facility which health services are provided. I couldn't confirm with 100% certainty because I am not a lawyer if we would consider a correctional facility to be included in there. Again, like we have the ability to make exception if a delegation is authorized for a specific restricted activity. So if we deem that specific restricted activity would need to be delegated in a correctional facility, we could discuss that with bylaw drafter and making sure we provide that exception. But right now, here, like if I heard the question correctly, I will make the assumption that this may have come from psychology. And in that case, because there are no delegation authorized right now, I don't think there's an issue, but I will take note of asking just so that we clarify our own understanding of that term.
Thanks, Shoni. And there's a similar question, but different environments around healthcare facility. There may be community-based settings such as a grocery store or community gym that are included for the purposes of supervising a component of an exposure plan for an OT. And there's interest in knowing if healthcare facility also encapsulates scenarios like that.
Again, for OT, I would expect we're talking about an assignment here, not delegation. There's no currently delegation authorized for OT. So the relevance of that definition, I think, is we don't need to worry about that. But a grocery like shopping, no, would probably not meet the definition of a healthcare facility. As I've mentioned, we have provided exception for some other type of settings, such as like work environment, construction sites, schools. So if we were facing a situation where we think that delegation is relevant and is in the interest of the public to happen in specific setting, the college can provide that exception in bylaw.
Thank you, Joanie. Will clients have the right to refuse to see a supervised student and be provided with direct care from the health professional instead?
That's an interesting question that I don't think really is pertinent to the topic of delegation, but technically, yes, a patient could kind of I think again, I would be curious to dig deeper. Like usually, like a teaching hospital has probably some policy and information about that, and that is based with the agreements that they have with the university and the education program. So I would probably send that question to practice support so that they can debate about it and provide a nice nuanced answer. But that wouldn't fit in the context of delegation here.
All right. What is the required documentation for delegation? Is there a way to have a type of standard order for certain situations or patients that the professional has already approved?
Is there so I've covered a little bit of what are the requirements. So like the consent need to be documented, what is being delegated needs to be documented, and to whom it is being delegated needs to be documented. Again, when we're talking about delegation, so I'm not talking here about assignments, but which, probably similar, we would have similar expectation, maybe just not the name of the delegatee, but in terms of, is that possible to have a standard form? Like there's probably can be some wording that like you can develop to help you kind of feel comfortable that you're meeting those requirements. I usually tell people when we talk about forms that they need to make sure that it evolves with the patient need and the context and not get too attached to a rigid form. But yeah, there could probably be some wording that people develop to kind of feel like they've met. But as I said, the current expectation is that consent is being obtained and documented, that what is being delegated and to whom.
Thanks, Shoni. I'm seeing a lot of duplication in the questions. So I'm not sure how much longer you want to stay on. I have a quick question here. Doesn't look like it's specific to delegation, but I'll ask, and if we need to refer it to practice support, we can certainly do that. Can a psychologist do a house call? That is, for example, go to a disabled client's home to do an assessment or conduct a therapy session.
I don't think that relates to delegation unless I am missing something, but and also I would need probably a bit more information about like the house call, but I don't think that is related to delegation. It looks like this is unless maybe I don't understand how the question has been framed, but I don't see how, because we're talking about what the psychologist can do and what.
I'll maybe try and answer it. The college does not dictate practice settings. And so we don't have any rules that would determine or identify where an actual health service intervention would occur. So that wouldn't be something the college would develop rules around.
That's true. Yeah.
Thank you both. So yeah, I think we've responded to all of the questions. There's some duplication here. We'll synthesize all of the questions and make sure that they're posted on the website. It'll take us a few days, but we'll make sure that we get those questions and answers to you there. I'm also seeing a comment which is aligned with some of the questions that we've been seeing around some confusion between delegation and assignment. So certainly appreciate that feedback because we want to make sure that this information is that there's no confusion and that there's clarity with the information we're providing. So we'll certainly take that to heart and consider the information that we're posting on our website and sharing with all of you folks to make sure that the intent of the information is being presented in the way it needs to be. So thank you folks for all of that. I think we've gotten through all of the questions, Shawnee and Diane.
Perfect.
Thanks, Michelle. So thanks everyone for joining us tonight. As Joanie mentioned, the next webinar is on quality assurance and continuing professional development on January 29th at 4 p.m. So hopefully some of you will be able to join us then. Thanks, Joanie, for your time, as well as Michelle and Naomi, who are here supporting the webinar. So thank you so much for joining us and have a good evening.